Jeffrey Charles Hardy. Welcome to the Dear Souls podcast. What ignites your energy to do what you do on a daily basis?
Talk to you.
Beautiful.
Yeah, this is a wonderful thing to be able to spread the word. And the word is really just very simple because I was a planner for my whole career.
Hmm.
And I just want to see us start using the same type of tools that I was using to plan the second human evolution. So I'll leave you to asking any questions that you want.
Perfect, perfect. So, can you share your journey? What led you to work in healthcare and how did your career evolve over 50 years?
Well, let's see. I was 19 years old, and I know I don't look that, you know, I'm 77, forgive me, but that's just
You
where
look
it's at.
amazing.
And well, so do you. What's your phone
Thank
number? Where
you.
do you live? Anyway, I started out as a hospital corpsman in the United States Coast Guard Reserves, and so 19 years old, and all of a sudden here I was taking care of a bunch of kids who were coming back from Vietnam, Mekong Delta, you name it. Yeah, they got shot at, but mostly it was snake bites or they fell and broke their leg or something. But I was taking care of these guys, and they were absolutely the most wonderful guys in the world. And at the end of the day, I just felt so exhilarated, so exhausted and exhilarated because I realized that I had a new feeling here, and it
Mm,
came from the process of caring. So by caring, I ended up having this new feeling that I ended up calling peace. Hey, what do you know? It's not
mm,
that space between two wars or after a war. It's not even sitting up on top of a mountain all by yourself with your arms and legs crossed and looking down into the valley where everybody is suffering and in pain. No, this is a peace that is a feeling, and it's something that comes from within. Then I met tons of nurses after I left the Coast Guard. I worked with Kaiser Foundation International. I worked with a lot of hospital people, and nurses became my dear, dear friends. And I realized they already know that there's a link, a strong link between caring and peace. They have it. I was thinking I just discovered this thing. I did not discover it at all. And then I met women who are nurses and men who were nurses and traditional healers all over the world. And I'm talking about in the outback. I'm talking about in Africa. I'm talking about in the Caribbean, all these different people who were caregiving. And guess what? They all had that feeling of peace. And it's funny, at the end of the day, we're all supposed to be exhausted and we're all, let's go to the bar and have a drink and then go home and go to
right.
sleep. We all were invigorated at the end of the day. Even these poor nurses who had to work in these hospitals that had been converted or designed like hotels where they had to walk down long corridors, which really aggravated me when I started getting into the design portion of my
Mm,
business when I sold my company. But even before I sold my company, I was trying to get architects and engineers and hospital owners to design a nurse focused hospital. I mean, because if you ask the nurses, they don't want to be walking down long, 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 long corridors. They
I know.
want to be able to be in what I call just very simply an ICU or a CCU environment, an intensive care unit
Right,
environment, where you don't have to walk 9 miles to your patient.
right.
So my career started with the bedpan. I mean, that's the first thing I did when I was hospital corpsman working in an infirmary, which was a low-level hospital for returning Vietnam vets. And then it gradually became management engineering, and then it became helping architects design brand new hospitals and clinics all over the world. And then eventually I decided to get rid of that darn for-profit business I had,
Mm-hmm.
get into the nonprofit and start helping
Mm,
some of the people all over the world that really needed my help, not because somebody could pay. And
exactly.
so I ended up working for these countries that, it's like, can I see your driver's license? And do you have a credit card so that you can pay for your care? No. I started working for the people who really needed the care and couldn't
Right.
pay for it.
Is
And so
this what
that's
inspired you to open up the whole Care for Peace Foundation?
Well, actually, Care for Peace Foundation, the idea of Care for Peace came from, 50 years ago when
Right.
I was in the Coast Guard. But then it popped up again when I was talking with the governor of River State in Nigeria, and we were talking about the the reason why I was there was so that
Mm-hmm.
I could discuss building, potentially building a women's and children's hospital right in Port Harcourt, which was the capital city of River State. And he's telling me about all the things that are happening in the country, and
Mm.
it's pretty scary. It's a tinderbox. It has Procol Harum. It was the place where they had the Biafra wars, where just awful, horrible stuff, and the tribal and ethnic animosities are still there. And
Mm.
he's saying, this is a mess, and I'm sitting here in his mansion after having driven through traffic for 2.5 hours, only 20 minutes away because so much traffic. I said, look,
Wow.
let's not build a hospital. Let's build a bunch of little tiny clinics that are on the periphery of Port Harcourt so that, number one, people aren't driving into the city and getting into the traffic jams, but number two, they can be in these clinics that are closer to where they live.
Mm-hmm.
And let's put a whole bunch of people who are the caregivers, which is your doctors and nurses and your traditional healers, all in these tiny little clinics. But
Mm-hmm.
let's make sure all of them are multi ethnic and different ethnicities. And I got that idea from Israel that at the time had a hospital where they had Palestine, they had Arab, and they had Israeli doctors taking care of any patient that walked in the door. And I
Wow.
realized, wait a minute, this is a good model. So I said,
Mm-hmm.
why don't we design the clinics to be caring for peace? And let's call them the Care
Mm.
for Peace Clinic. At any rate, nothing happened to my knowledge. It might have, because I ended up getting called very soon afterwards by the government of Myanmar, and I ended up going over there because they thought they wanted to have a hospital, and I was known as the guy who could be part of actually start the whole planning process
Right.
of a hospital. So they called me before they called the architects, which is great. They
Hmm.
read the articles, don't call the architects yet. Let me come
Right.
in and make sure we're going to be asking the right questions. And anyway, they did. And I said, guess what? You're not asking me the right question. You don't need a hospital. You need rural health care. So I ended up really, really just doing the most wonderful project of my entire life, which was building a very remote, deep rural clinic in the
Wow.
far reaches of Myanmar. I mean, I'm in the San Francisco Bay Area,
Mm-hmm.
and it took me 2.5 days to get to this place where we built the clinic. It's beyond anywhere roads are. It's
Wow.
like, took me 3 airplane trips and a kind of a tugboat type ride all the way up
Mm-hmm.
a Delta River that was very much like Armageddon.
Oh my God.
It was like, Curse, where are you? The horror, the horror. Anyway, it
You're
was the
so
most wonderful.
courageous and brave.
You know what? People in Myanmar are absolutely the most wonderful people in the world.
Wow.
I made so many friends of the union government people who, of course, have all been booted out by the military junta because we were planning, I should say, because that they kicked us out. They kicked the government out. Aung San Suu Kyi, no more. See you later. She was gone. She's actually still in home. What is it called? Where she's imprisoned in her own home.
Oh
A
God.
lot of people in prison. And, so we could build the promised 250 more of these throughout the rural area of Myanmar.
Mm.
So I didn't have anything to do after that. It was like, I can't send emails to these people. I'm working,
Yeah.
hard right here in California planning all this stuff, and all of a sudden they can't plan anything. I'm sitting there looking at all these plans. I'm saying, what am I going to do? What am I going to do? So I wrote a book, and my book is called To Care for Peace,
Nice.
a global mandate to secure the second human evolution in perpetuity.
Talk to me about that. We were going right into that.
Well, thank you all. Take that as a good segue into defining what I'm talking about when I say second human evolution. There are three stages of human evolution. Now, this is very important. I am not talking about the Holocene. I'm not talking about the Anthropocene or the Anthropocene. I don't even know how to pronounce it. It is not related to geography, geology. It's not related to anything other than our human trajectory that began 2.5 million years ago. I mean, it ended as in the middle of the first, excuse me, the end of the first human evolution. I call a time somewhere between the 1950s and the 1960s
Okay.
when we had already conquered nature. Humanity had conquered nature. We were the keystone animal. We were supreme over all animals. We could destroy the planet. And we
Mm.
even had mutually assured destruction sometime during that period of time. But we also had the peace movement. We had Martin Luther King. We had the French existential movement. All sorts of things that were, and don't forget, we had some great music in the
Oh yeah.
60s. Just
Oh yeah.
unbelievable music. And I'm still such a Beatle Beatleophile or whatever you want to call it. I mean, that's what I exercise every morning to. It's just, it's just wonderful. I still have that 60s stuff in my heart
Nice.
and in my songs.
Did you get into the whole hippie stage? Did you go through that stage?
We faked it on a weekend. No, if the real hippies were pretty scary. I mean, they were just,
Yeah.
they were just a new kind of bum. I don't know, at least the ones I met. Um, that they weren't principled people.
Right.
And an article was just written about me, which was fascinating because they picked up on something that I hadn't picked up until they interviewed me, and it was in the Los Angeles Tribune.
Okay.
And I can't remember what the headline was, but it was something about how my planning originated during all the different marches that I went to some of the marches, the peace marches. And what was that? Wall Street, that Wall Street one, Occupy Wall Street, and all these things. And they
Hmm.
picked up on something that I hadn't really picked up, and that is that after all those marches, there was really no plan established for getting rid of what it was that we were marching against or marching for.
Yeah.
And so they linked that to my desire to plan. And as I say, it was a Los Angeles Tribune article. And the guy who wrote the article, just hats off from me because I had not linked that. But
Wow.
no, when you ask me what excites me or what your first question, and I said
Yeah.
you, it's the you, not just you, Jacqueline, but also the people who are reaching out and trying to figure out what it is that we need to do so that we can avoid all this talk and worry about the sixth extinction. I can't
Yeah.
talk about sixth extinction. I'm not going to be in charge of that. I'm not going to be even close. You want to talk about it? Well, let's talk about drinking Kool-Aid. I don't know. There's just a lot of things that you can talk about that I just don't relate to. I want to talk about the next step. And the
Right.
next step is just my job. My job is to look at where we are now and help figure out how we plan where we're going. So you got the first human evolution that ended sometime in the middle of the 60s. Now we are in what I'm calling the suspended human evolution. And this is the time where we're looking back and we're looking at all the detritus that we are living with that is still dragging our feet like the ball and chain. Janis Joplin singing that song. And it's dragging us back or to stay in the first human evolution. We've got to see where we are. And
Right.
we have to then think about where we want to go. And so the next question is, well, has the second human evolution started? No, it hasn't. But I'm going to go right back to that experience I had in the Coast Guard when I was 19 years old. And I will tell you this the first human evolution is all about killing for peace.
Yeah,
The second human evolution had best be where we learn to care for peace. That's the key.
that's the key. Yeah, yeah, I'm there with you. I mean, I don't always believe that we need to fight to get our, word across, or whatever it is that we're trying to do. I think that sometimes coming from our hearts and caring and wanting something to be done in a more loving way, could still be done,
Good.
and of course we had to go through the wars and the killing and all that. It's part of whatever it is that we have to go through in this earth. But at the same time, we have to transform that, which I think is already starting to transform, where we're going more into a peaceful area. So I'm very hopeful that humanity is going down the right path. We're still going through some stuff, that we have to kind of shed off and transform, and just kind of get more in our hearts. But I think we're on the right path. I think we're on the
Amen.
right path. Yeah. Amen.
Amen. Thank you. That's
Yeah.
some validation for me. I
You're welcome.
appreciate that. We have to start with the right language.
Yeah.
And, part of the language I need to help institute as my job as a pre-planner, okay? I'm not running for any office. Now, I just wrote an article that was published. I'm trying to think. It's called the Global American Party. I want to get away from these two parties that are just pulling us down here in this country. I want to get away from both of them. And I think the way to do it is to not keep thinking that either of them and together both of them are really putting their finger on the problems of the world that we have to deal with.
Yeah.
And I want to see us start a global American party. And I think that what we will do to get there is to use our planning tools. I'm a pre planner, that's it.
Yeah.
I am not going to be the leader. My name is not George Wallace or Andrew Yang who wants to start a third party. No, I'm talking about a global American party, which at first will be facilitated here in America, but eventually it better be a global party
Right. Yeah.
because I'm looking for the world to have a global nation. And I
Talk to me
want
about
my,
that. Let's get into that. Talk to me what that's gonna look like.
well, I'll
Because
tell you what,
I'm not too much about politics. It doesn't affect me. It hasn't affected my husband. Whatever's happened, we don't feed into all those crazy energies and political parties and blue and red, and we don't. It doesn't affect us. We've chosen different. Talk to me about what that is going to look like, because I believe in unity. I believe in community coming together. I don't believe in division. That's all. It's been happening for hundreds, thousands of years. And I think we all need to come together and just kind of work through this as a community, not
amen.
separate.
Yeah,
Yeah,
totally agree. And a global community is not going to be based on anything that we use today to base our nations. It has to be based on the global needs, the need to control our population, to control our libidos. I mean, we have to control the right now we have over militarization, over consumption, overburdening the planet's resources,
yeah.
overpopulation. Think of all the overs you can think of. But
Oh
my
yeah.
idea for a global nation, I would like to the children in our clinic that we built in Myanmar that is still up and running and doing wonderfully in a little village called the Pantopian Village West.
Okay.
I want those children to be able to every morning get up, go to school, and pledge their allegiance to one global nation under God, indivisible, with liberty and justice for all. That's my vision. And I want every child in the world to be able to pledge their allegiance to the global nation. And that has to be planned. And that is part of the second human evolution. Because the second human evolution has to be we need to bring our individual care for peace, our care about peace, our ability to take care of peace to the table. And we need to be able to imagine, to visualize, and then look at reality, because this is not fantasy time. This is reality time.
Yeah.
We've got to look at where we've gone, where we are now, and where we want to go. But we've got to use planning tools,
What is it going to take to get to that second evolution?
exactly what you're doing. We've
Hmm.
got to do a lot of talk,
Yeah.
and we've got to share a lot, and we have to dedicate our lives to planning the second human evolution. So that begins by thinking about everything that we're saying now. From now on, you are going to be talking to other people, other guests. Wonderful. You're not a politician that I know of.
Mm-mm.
You're not on some council. You don't have a whole bunch of people voting for you, so you
No.
don't have to be thinking about what somebody else might think about what you say. You have a broad spectrum of the entire planet. Anybody who has a, I guess, an iPhone or Android or whatever, a television or whatever it is that they can watch your podcast, you could be talking. You could be putting everything that I'm saying and you and I are talking about into your own words and get it down to a level where it's not talking about belief.
Yeah.
It's not talking about opinion, because beliefs and opinions are allowed in the discussion,
Yeah.
but we have to define them as such.
Right.
Because when we're talking about reality, we have to say, okay, I'm not going to talk about abortion. I'm not going to talk about whatever might be the latest hot button. I'm going to talk about the reality. Okay, how many people are leaving on a regular basis on rickety little boats from the northern shores of Africa trying to get across the sea, the Mediterranean Sea, to any country on the other side that has more promise? What are we going to do with all the people who are coming from South America, and I understand even from China
Mm.
to South America, to be able to try to get across the border into America, and from Canada getting across the border into America? Why is all this migration happening? We need to look at reality. This is not whether you believe in my migration. No, no.
No.
Reality, reality. I want Donna Summer or whoever it was who's saying Divorce. I want them to sing a song called Reality. Reality. We're talking about reality.
No, that is true because you know what? If every country had what they needed to be able to live a good life, to have all the resources, everything they need, there's no need for people having to cross over borders or anything like that. You just come and you go to different countries to explore, to be able to travel, to be able to have a great time and take pictures and eat the food from different countries. And that to me seems so much nicer than having to struggle to cross the border to go somewhere else because you don't have the means in this country, so now you have to go over to this country and go through all those struggles. And I'm Cuban. I came from Cuba when I was 2 years old. I don't remember anything. We came in the Mariel, and I've recently had some family members leave Cuba and go from Cuba to Guatemala and then end up in Mexico. And just from Guatemala to Mexico, they ran into a lot. I mean, things were stolen. I mean, they were not killed
Yeah,
by the grace of God, but they went through hell and back,
yeah,
and
yeah,
with little ones, the kids too. And I'm just like, these people are, I mean, extremely brave. Or I don't know what the word is, but I don't know if I could have done anything like that because it's dangerous. And I think that if with this second human evolution, if we could get to the point where we're like, hey, what does each country need? What are the resources? How can we get to where everybody can be, thriving, instead of like not getting anything done or not being able to go to college or whatever it is that they're wanting? Why can we just put all these resources and all these different countries come together, and now we could have a much better freaking earth.
yeah,
We're
yeah,
taking care of the earth. We're more sustainable. We're not having all these nasty fake foods that are killing our vessel, our human vessel because we're getting sick. I mean, I've had to heal myself for the last 2.5 years because of all the traumas that I've gone through, all the, health situations that I've gone through.
Wow.
And I was to the point where I almost died twice already, in the last
Wow.
3 years, or actually
Wow.
five, because we had a car accident too. So it's like, man, like we have to go through all these traumas, all these trials and tribulations. Fine, I get it. It's part of our, evolution as humanity, to grow and expand and learn whatever lessons. But can we make it a little bit easier? Can we come together? Can we work together? Can we just love each other instead of everybody fighting? I'm seeing it even in our grandkids. Between my husband and I, we have 12 grandkids, and we have two new ones that add to the 12 that are, we have a family integration coming in. And I'm seeing some of these kids with mental health, and I'm just like, man, what can we do? What can we do to help this? And it's in the foods, it's in the parenting, it's in all the generational traumas, it's in everything. So what do
Right.
you do? What do you do? It's so hard.
It's not just what do you do, it's how. And we've got to get to the how,
To the how.
because asking the question, that's good. I'm glad you asked the question. I'm asking the
Yeah.
question, what do we do? But what do we do is something that you do when you're standing. And we need
Right.
to think about how, which is the road plan. What's the road map? What's the plan? And this is where you come in. You can help lead the charge of how would you approach. Just think about the approach. You don't even think about how to plan, because planning is different than pre-planning. I'm a
Right.
pre-planner. I'm a facilitator. If you really look at what my job is, no architects around. I'm hired by someone who thinks they want to build a hospital and they got a bare lot somewhere.
Right.
So
Yeah.
that's my ideal pre-planning location. I say, well, why don't we not build anything? Why do we even have to build let's challenge the idea of building anything, because
Exactly.
I've been involved in designing and building, planning, designing and building a hospital that shouldn't even be built.
Right.
It's just,
Yeah.
so, you gotta get into the how, and the how starts with pre-planning, and pre-planning starts with the approach.
Yeah.
So
No, I agree.
how, and that's why I'm saying it's not the global American party is not a third party. Please don't even go there, because all
Yeah.
the third parties that have been started in America are started by a person. This has to be something that you guys start. Okay?
Yeah.
I'm past my planning stages in life.
Right.
I will still do pre-planning of the second human evolution. I'm not going to do any more hospitals or clinics.
Right.
No, no, no. I want to use these tools to the advantage of the planet, and that's it. Am I in fantasy world? Yeah, a lot of me is the fantasy world. I have
It's
dreams.
okay. It's
You know,
okay. Dreams are
I've
great.
got dreams, but I have a dream that you, Jacqueline, will take this ball and run with it, and
Mm.
talk with your people about how
Right.
get let's get the words from other people. You're just hearing my words from my
Yeah.
experience as a pre-planner, but you got to get ideas from, oh my gosh, I get nurses ideas, doctors ideas, I get
Mm.
radiology tech ideas. I mean, I've been lucky to be sitting around the table with unbelievable people from every kind of
Mm.
healthcare profession and building profession known to man, okay, in
Right.
every country. And I've been able to talk with people who are representing the clinic, representing the patient.
Right.
So I've had this wonderful experience of somebody coming in and says, I cannot talk too much English, but I have been cleaning a hospital for 20 years and they don't give us big enough clean uh, closets for our mops and brooms.
Hmm.
So
Something as simple as that. Build a bigger
that's,
closet.
I can't tell you, when that lady said that to me, I'm thinking, wow, this is incredible.
That is crazy.
I'm sitting here looking at a blueprint and I'm looking at all the closets in the hospital. They don't have enough closet. They didn't have enough broom closets. They
I
didn't,
mean, just healthcare industry is it's crazy. My husband, he's a career advocate, a recruiter for the healthcare industry for over 13 years. My sister, she's a nursing field. My mom just retired as a CNA, and the horrifying things that my mom would tell me in her own career, how these patients are being treated, and how they tell you, these companies tell you, you cannot put your heart into this. They are just a body, and you go, you do your job, and you go home. You do not attach to them. You do not do anything else but whatever is required. And my mom's like, I can't. I have to put my heart into this. That's why, she had to retire as soon as she turned 65, because she mentally got drained from so much crap, so many things that are not, I don't think, are right. I mean, if you have a patient, you should love that patient. You should take care of that patient. You should do everything in your power to make sure that patient could even heal. But no, it's all about the money. I mean, she was taking care of one girl that got into a car accident, young girl, beautiful. She's bedbound, tons of money. She got paid like over $1 million for the accident. She has someone that takes care of all her money, like a lawyer, an attorney, and she only gets given whatever supposedly she needs, and the money has been wasted. They actually took my mother out of the case because my mom was getting too close to the what was really happening behind the doors of all the money being stolen and so many things happening. I was like, but do they care about her, healing, or do they just want to use as much money from her as possible behind closed doors and just give her what she needs, supposedly what she needs, which is nothing. My mom had to buy her clothes. My mom would have to buy her shoes. My mom would have to bring her like little things, like little pastries, just to kind of like, because I mean, a girl bedbound with over $1 million in her bank account and has no control over it, the attorneys and the judges. That sucks. I don't see that correct. And she could speak. I mean, she lost a portion, I guess, of her brain, but she is still very aware of things. It's sad. It's sad. I see those things and it just breaks my heart. And I'm like, you know what? The healthcare industry needs to go somewhere. Because even now, with my mom being retired, she still has to pay. Now she has to pay for Medicaid out of her retirement money. I mean, she's been paying for what, 50, 40 something years in this country, 50 years in this country for Medicaid, Medicare, all that stuff. They take it out of the paychecks, right? And now she still has to pay a monthly, almost $300 a month for Medicaid.
Well, I
It's
hearken back.
crazy.
Your
It's crazy.
your basic theme here
Mm.
is the theme about the inability to care because it's so darn busy, and they say don't do that. And the thing you have to
It's all
remember
about
is
the
that
money.
the purpose of a hospital is clinical delivery, and care is not part of that equation. So when I
No.
first started, care was very much a part of it because we had a system before 1982 when the whole
Okay.
DRG thing happened.
Okay.
It was cost plus. So whatever your cost was, they'd add 5%, and then you could take care of everybody. You could care. You could
Mm.
provide the love and the touch. So
Right.
1982, everything started going in the just clinical delivery,
Mm-hmm.
that direction. And so I've watched it and I've been involved in that whole process the whole
Wow.
time. And so, and I have seen that pain, but then I've also worked outside the country where there's a lot of care going on. I mean, you'll see a traditional nurse and a regular nurse team up to love a patient.
That's
Uh,
beautiful.
I w- which was wonderful. Now, this was like 30 years ago when my great Aunt Mary had passed, and the Holland government gave her a caregiver around the clock, not the same one.
Beautiful.
Obviously, they took shifts around the clock.
Yeah.
They didn't have to pay anything. And the thing that I noticed, because she was in the process of dying, she called California and I flew back to be with her by her side when she was passing. And I met a couple of the caregivers, and it was fascinating. One of the caregivers, they were all young women. One of them bent down, and her blouse flew open, and she had a whole pile of chains on her. And I was going, "What the heck is that?" And Aunt Mary is going, do not worry, she comes from the red. It was a prostitute. But you know what? So what? This
So
gal
what?
was providing care.
Mm-hmm.
And she was wonderful. I just, and,
That's
and
beautiful.
I've thought about it many times since because it's like,
Hmm.
boy, that redefined something for me. I mean, it was just, she had just been helping Aunt Mary, who was a pretty hefty, she was very hefty Dutch woman, real
Right.
buck, real big one, so this poor woman had to help lift her up, and it was a mess. She almost fell over in the process,
Oh
but
my God.
boy, I learned a lesson that moment. It's like, so the traditional caregivers in Myanmar, for instance, were unbelievable. I was coming into a town. I was working down a path, and I was going to another town, and I
Mm-hmm.
had almost gotten to the town, but I heard drums, only one drum, but I heard this drum, and then I walked in the town. Where is that coming from? And I walked, and here was a man who was dancing with his drum. It was one of those long congos that hang
Mm-hmm.
on her side, and the little belt holding the congo. And there was a woman dressed in the traditional Burmese, and so was the
Mm-hmm.
man. Beautifully colored skirts called longis. They had hats on, you name it. And they were dancing and singing. And there was a woman on a high platform who was up on her elbows watching this. And then there was a regular nurse who they all wore the same thing throughout the country. They're these bright red skirts and white blouses and white nurse hats. Yeah,
Okay.
just like the old days, just like
Yeah,
the
yeah,
old
yeah.
days. And she was sitting there and she was kind of going like this. And so I was kind of going like this. And then I found out during the process that these were medicine people taking care of this lovely lady who was up there and she was sick.
Oh my God.
And I said, wow, what a wonderful thing.
That
And
is
then I was
beautiful.
back in America one time with one of my favorite nurses of all time, Kathy Pelly, who was actually at this point she was a hospital administrator of Glendale Memorial Hospital.
Mm.
And I remember walking with her well, we were walking down one of those no hidden patient units that just infuriated me, one of those long hotel type
Yeah.
units, and we heard some singing going on. And we walked in there, and a couple of nuns singing a Christian song to this
Yeah.
lady who was sick, and
Oh.
her husband was there, and her children were there. The whole room was filled with these, and the ladies were singing, and they had big smiles on their faces.
Wow.
It was a happy moment. And I was like, it's so beautiful when care is part of the clinical delivery process. It
Yeah.
is just wonderful. So I'm sorry for your mom. I'm sad for your mom. But I'll
Yeah.
bet you all up until the last minute your mom cared. And it
Oh,
sounds
she
as if
did.
she did. It
She
sounds
did.
as if
She
she did.
did. She
Yeah,
always did. And people
yeah.
loved her and she always had great recommendations and won awards. And, she's just, I mean, she did it for, shoot, over 20 years, And then obviously her health kind of got in between that. And I finally convinced her last year, I'm like, you need to retire. You need to take some time for you, get away from all this and focus on your mental health and your physical health because she gained some weight also. And I said, now focus, time to focus on you to get yourself back to being strong and healthy and, full of vitality. So let's work on that now. Don't worry
Yeah,
about everybody
yeah.
else. You need to worry about you
Right.
now. You
Touche.
know, that's where she's
Now,
at.
to be expedient, I think that's a word. Do you have any last question that you would like
I
to
have a few
ask?
more. Yeah, I have a few more
Okay.
questions. I wanted to kind of go into the guiding templates that you developed for like the second human evolution. If you could talk a little bit about that and explain the simple terms on that.
Well, yeah, 50 years ago, right after I left the Coast Guard, I ended up helping a Kaiser hospitals and clinics up in
Okay.
Sacramento. I was the lowest paid clerk in the emergency department. So from bedpan to clerk, it was a pretty good jump. I really enjoyed it. I got paid a lot more than I did in the Coast Guard, which was I
Yeah.
got paid something, which is pretty good. But I ended up moving a lot with the Coast Guard, and I ended up within about 3 years working with the top people who started Kaiser: Sid Garfield, Maury Collin, Robert Richard, Dan Fletcher, some of the greatest people on the planet. Some of these people who started the whole preventive care is very important process, multi-phase basic health testing, all sorts of wonderful
Oh,
stuff. At
wow.
any rate, I ended up tapping into this mentor of mine, Dr. Robert Richard, who we hit it off real big, but he was a writer and he was one of the idea guys at Kaiser. He was getting tons of money and he bragged about it all the time. I'm the highest paid consultant to Kaiser and I can pay for my own health care. You name it, even though we got free health care from Kaiser. But
Okay.
he and I really hit it off and he helped me design what I called the templates, which I'm now calling the Care for Peace templates. There's 4 of them,
Okay.
and they're to help people get their arms around what it means to care for peace. And it starts with the personal template. The personal template is just very simple. It's with myself.
Okay.
It's with my relationships and with the environment. We gotta section this off so that we establish what are the values, the attitudes, and goals that I have for myself.
Okay.
Care for peace, touch, help other people for peace with the world. Peace with myself, peace with my relationships. And then the second template is the relational template. But I give people an opportunity to imagine what the first human evolution care for peace relationship with each other was
Mm-hmm.
and still is in some ways. And then what would that look like in the second human evolution? I mean, you could just look at, go from, let's see, let me grab one. I know I've got life through consumption is a value to any individual in the old days. It's, hey, I'm
Right.
just going to consume and consume. But in the second human evolution, we've got to think about life through productive work. We've got to
Mm.
think about using our hands. Remember, I said how. How is the
Right.
most important. So the how has to flow through all these. And so
Okay.
it's between the first human evolution and the second human evolution. The third template is the cultural template, which is not from the first human evolution to second human evolution. The cultural template is our attempt at ensuring there are physical aspects that are matched up with spiritual aspects.
Mm.
I have a very difficult time with the Karl Marx approach that has been misconstrued by Hitler, by
Mm.
China, by Mao, you name it.
Yeah.
It's not to everyone according to what their needs are, from everyone
Right.
according to their ability. That's fine. That's the physical side. But what's the spiritual side? We've got to be
Yeah.
looking at the spiritual side. And if we're going to go into the second human evolution, we cannot deny the spiritual that got us here.
Yeah.
Because the
Yeah.
spiritual is the care part.
Exactly.
Spiritual is the part of us that we
Mm.
share. And
Yeah.
we share it in many different ways. Look at teachers, look at people who provide customer service. My younger son is a plumber, and people are constantly writing how much a wonderful guy he is because he's not just a plumber. He provides care, huh? This is going back to your
Yeah.
mom's situation as a nurse. You gotta have the care with the work that has to be done. So, and then finally, we have a fourth template, which is the organizational template. And this is where we basically have to think about our organizations and who our leaders are. I have a quote, something that I've said in the book that I've been quoted as saying, so I got to blame myself for it. And that is a government must strive to be as good as the best person it hopes to represent. But
Okay.
it and by the way, that includes Jesus and Muhammad and all the great people, Martin Luther King, Voltaire.
Yeah.
I mean, there's all sorts of wonderful people out there, but also the people that you and I know. your mom.
Exactly.
And the people, my wife, my children, my wonderful grandkids, we've got to say, oh, that is the best person, and I want to. And those are all the best people. Now, I want my leaders to strive to be as good as the best
Yeah.
person. Now, is the leader who's in charge of me and all the people I know as good as me? I'm going to leave that up in the air right now because I don't want
Yeah.
to start on that kind of negative
Yeah. Yeah.
track.
We'll stay
So
on the positive as much as
that's
we
we
can,
will stay
right?
positive, but
Yeah.
that's something that we have to do. We have to bring that to our equation, and
We
that's the
got to bring
reason
the
why
light
the
in.
fourth template is going to be extremely important because we've got
That's
to
true.
look. I don't know where is the fourth template. Oh, here, organizational. I mean, organizational. This is a from the first human evolution to the second. The first human evolution, just with ourselves, is supremacy. But the second human evolution with ourselves is diversity. Okay, simple words. I'm just trying to get people to say, okay, yeah, this is a duh obvious. Thank you. I'm glad that you think it's obvious because there's a lot of people who don't think it's obvious or hadn't put the words to it.
No.
They say this happens to me all the time by the way when someone says, "I know that. I just hadn't put the words to it."
Hmm.
That's great. Now put it
Yeah.
into your own words.
No, that's true.
Oh, and I've had challenges to my templates, which is great because what I do is I go back and I change it so that,
Yeah.
uh,
Yeah, no, that's beautiful. I mean, change is great. We're forever changing, and we need to keep bringing in light into situations because we've been so programmed to follow versus having our own power and our own voices. So
I,
this is where I'm at. This is why I created the podcast. I've gone through a lot of things in my life, and I was like, you know what? I have a voice, and I'm taking my power back. And if people want to hear it, great. If they don't want to hear it, turn it off, but I'm going to be me and I'm going to stay in the light. I'm going to stay in my heart as much as I can. And it's funny because I study different things. The last 2 years has been about my spiritual growth and being able to heal myself and all these things.
good.
And now I'm studying Kabbalah, and Kabbalah it's just pretty much it's a guide, a rule book to how we human beings should kind of live in this world and stop making shit so complicated when it's really not that complicated. We just
Sure.
haven't been given the guide that we need to, So I'm learning all these different things. And one of the things that the Kabbalah teacher said was that we need to bring spirituality even back into religion because religion has forgotten about the spiritual side. It's all been
Yeah.
about the fear and the controlling and all these things and taking people's power away. And you got to go outside of yourself to reach God. God is inside of you, man. Like we come from the
Amen.
creator. We are all together. We're all connected. There's no division. We've created these crazy division of, you're from Africa and you're from Cuba and you're from this and you're white and you're black and you're blue. Who gives a shit? We're all the same. We come from the
Yeah.
same creator. You know what I mean? I'm realizing that everything that I've been learning the last 2 years from, the Buddha's teaching, I went to a 10-day Vipassana silent retreat, all these different things, it
Wow.
all intertwined. And Kabbalah is just confirming that everything that I'm learning, I'm on the right path. And there's
Yeah.
God's source light. Just plug into the light of the creator. And now you can create beautiful, amazing things
Yeah.
versus
Yeah.
being in the darkness.
Interesting. And I'll bet your Kabbalah process includes how.
Oh, yeah.
On the
Oh, yeah.
very bottom of my book, I've got
Yeah.
my most important quote, and that is the process is the solution.
Mm,
And what you're doing with the Kabbalah is you're identifying the what.
yes.
Now,
Yes.
how are you going to bring spirituality back into
Right.
religion? That's the question.
That's the question. And then you got these tools, and it's so simple that they even explain what the darkness is, or they explain what Satan, or whatever the hell you want to call it, what the purpose of the darkness is. He's our opponent. He has to give us darkness. He's got to give us all these trials, all these tribulations, all these crazy things to happen so we can tap into that and then say, wait a second, how can I transform this darkness into light and plug into the light of the creator so I could live a more abundant life? So
Wow,
I can
very
create,
nice.
so I can manifest beautiful things. And I'm just like, man, this is so simple. Why has fucking, sorry, humans, like they've complicated things so much, which is life is not complicated. It is simple. If you
Now
have tools, it's simple.
you said you're from Cuba,
Yeah, yeah,
so you're Cuban.
yes, 100%.
Now, did you bring some of the culture from? I mean, do you have some of that Cuban culture? Now,
I have,
let me.
I have my Cuban culture in me. Yes, I
Yeah,
was
yeah,
actually raised in Miami. Cuban parents, Cuban grandparents, everybody, and
yeah,
I'm very much, into my culture. I love my culture. I love the morals, the values, the craziness,
yeah.
how loud we can be. All these things, they're just so beautiful. I don't remember Cuba because I was only 2 years old, but I do remember what my grandparents, my aunts, my mom and my dad don't really talk about Cuba too much, but they did, my grandparents and my aunts and stuff. So I take whatever I've heard from them and kind of say, oh, okay. And then, we have a beautiful background on my grandfather's side. Our last name is Agramonte. And I'm the
Huh.
seventh, eighth generation of Ignacio Agramonte. And he fought in the war against the Spaniards and stuff. So, I've
Whoa.
kind of been tapping into that, that energy because I want to know. I want to know where I come from. I want to know what my ancestors are, the lineage, all of it. I
That's
need to
great.
understand where I'm from so then I can keep moving on my journey of healing
Yes.
myself and being able to help humanity evolve.
Wow. Wow.
So that's my mission. One of my missions.
Well, that is wonderful. I think it's part of your whole mission. I mean, you
Yeah.
have a mission and you living it. You're living it. And I'm glad to hear about your mom because that really I can really relate to your mom.
Yeah.
I find what a wonderful thing to have a mom who has that spiritual process in
Yeah.
her life.
Yeah. Yeah. No, I'm excited for her too. I'm really
Well, now
excited.
what's you get one last question, okay? Because
Okay, I get one
we
last
got to
question and then
yes.
I do three closing questions at the end. Okay.
Okay, okay, okay.
Yeah. So how can people and support your organization, the mission, your movement? How can people support you in what you're doing?
Well, right now, I don't care if they support me at all. I want
Okay.
people to, they don't even have to get the book. I don't, I'm giving them away. If you live near me, I'm just giving you one. I have not sold one to anybody I know. You know, it's on
It's
Amazon
okay.
if you want to.
Okay.
But you could also go to Amazon and read the black cover blurb because it's right there. You don't have to buy the whole book. But if you
Right.
want the templates, they're in the book.
Okay.
But don't support my organization. Just start thinking about what it means to care for peace, and start thinking about the fact that we are alone in the world. We humans are different from all the other animals. The human evolution is not the Anthropocene. It's not the Holocene. It's none of that. It's just us. So, we don't have anybody else but us and our imagination, our religions, our ways of doing things, our cultures, our rules of law, and start thinking about how you can help us, you can help all of us get into the second human evolution. That's what you can do,
That's beautiful.
and I'll appreciate it.
Yeah, no, that's beautiful. And to add to that a little bit, I think as we work on ourselves, on healing ourselves, our traumas, our mental health, and all these things, we actually energetically help others to evolve and change and heal and all those great things as well. Now, what advice would you give to young people that are wanting to make a difference in healthcare?
In healthcare, become a nurse, become a doctor, just get into the healthcaring profession, become a CNA. You said your sister was a CNA,
My mom.
your mom,
Yeah,
okay?
yeah.
Just anything. I've met nurses who started as candy stripers or volunteers, young girls just doing something because they had to do something in high school that was a community service, and all of a sudden they said, wow, I was, I know one girl, she came into my office. I was a director of medical records. She comes into my office, she says, Mr. Hardy, I have to be a nurse now. And I said, you've only been a candy striper for a week. She said, It doesn't
Mm,
matter. I have seen so much love that, and I've seen a lot of love in my own family, but this whole place is filled with love. And I'm thinking, wow, she hasn't seen some of the parts
yeah.
of this,
She hasn't seen it
but
all.
yeah, I mean, because they always treat candy stripers and, the volunteers really well because they don't get paid,
Yeah,
I guess, and they're young girls and their eyes are
exactly.
wide open.
That's
Anyway,
funny.
yeah, get into the health profession. We need
Awesome.
you. We need you.
Oh, yeah, definitely. And where can people learn more about your work and how to get involved?
Well, oddly enough, a friend of mine texted me a week ago and said, all you have to do is Google your name and you'll get everything. So if you Google Jeffrey Charles Hardy, then you'll get everything. You'll get probably 70 or 80 podcasts. You'll get my articles you
Nice.
know, and then by the time you've hit three of them, just go to some other site. You don't want to do too much Jeffrey Charles Hardy. I mean, I'm the only one who has to do Jeffrey Charles Hardy all the time.
Okay, no problem. And I'll make sure to put it on the show notes too. So we're at the end of the show. And as we wrap up today's episode of the Dear Souls podcast, if you found value in our conversation, don't forget to subscribe, like, and share this podcast with your friends. Your support helps us continue bringing inspiring guests to the show. And together we can inspire more souls on their journey to healing and growth. Stay connected with us for more transformative stories. Until next time, dear souls, thank you. Thank you, Jeffrey. It's been amazing. I
Thank you.
loved our conversation and we'll stay connected.